To Governor Charlie Baker talking to the president on a Zoom meeting about vaccinations. Let's listen in.
Opinion whether you think Lyft and these two outfits are going to provide free transportation. It seems to me, where I come from, a lot of the communities of color use these facilities because they don't have automobiles. Anyway, I don't want to hold you up from the game here either, Charlie, but you've been doing a hell of a job across the board. You really have. Hope that doesn't ruin your reputation coming from a Democrat, but you're doing a hell of a job.
Thank you very much. Thank you very much, Mr. President. And I'm going to also give Jeff Zients and his team a shout out for all the work they've been doing to help us, help you, the American people, succeed in getting vaccinated. Massachusetts is number 2 in the country. We have about 74% of our adult population that's gotten a first dose. My friends north of us in Vermont are ahead of us, and we're going to do all we can to catch up to them. But our program was basically what I refer to as a mixed model. Our mass vaccination sites did about 1 million shots, but we also had regional collaboratives with local boards of health and local providers in areas where we had a lot of geography between and among people. We had tremendous participation from our healthcare community, all the way from the hospital systems to the physician offices. And our community health centers were a big part of the show for us very early on. And with respect to equity, one of the places we started straight out of the gate was a big aggressive program to do outreach to congregate care. And this meant, group homes that take care of people with developmental disabilities and mental health issues. It meant hitting a lot of the senior sites that weren't part of the pharmacy program. It also meant going after homeless shelters and some of the folks who worked and were residents there. And I think in many ways, that approach, which sort of targeted a variety of different objectives early on, is the way we framed it all the way through. And our community health centers, to sort of follow up on several previous comments, have been big players for us. And in some cases, they've been partnering with hospitals and with churches and senior centers and community centers and mobile vaccine players to do pop-up clinics. And it's very interesting when you have the muscle of a big hospital system that can be a big supporter of a community health center that's running a program in conjunction with them in a church or a community center or a senior center. You've basically got all the trusted voices in that particular neighborhood working together, delivering the same message, which is that this is a good idea and this is something that you should be willing to do. And we, of course, track our data as well. And we've managed to successfully vaccinate so far our Hispanic community, our Asian community, our Black community, a rates that's right up there with our white community as well. We still have some work to do there, but we've made a lot of progress. And I guess I would say that I think the transportation issue is a big deal, and the decision to include folks like Lyft and Uber in this can make a big difference. We have special programs for homebound folks that we do in conjunction with our local boards of health, where they are literally identifying populations that can't get to a vaccination site, no matter how close it might be, and making sure that we're going out and meeting them where they are and making sure they get vaccinated the same way everybody else does. I think the other thing I would say is that for all of us, one of our great opportunities and our great challenges to get over, whether it's hesitancy or equity or more confidence, is the more people see this happening among their friends and their families and coworkers, the more likely they are to sign up and say, you know what, I'm willing to play. And the walk-up stuff has made a big difference too. I was visiting one of our pop-up sites last week, and they had about 50 or 60 appointment visits. They had 700 walk-ups, and I think the walk-up stuff can be a really big deal in terms of making sure that we create other opportunities for people, especially younger people. I get 3 kids in their 20s. I'm well aware of how they feel about appointment scheduling. I think in many ways, as we move down the age quartiles here, being able to just make this available in a bunch of different locations and recognizing and understanding that everybody doesn't work off a calendar and a schedule is going to be a big part of getting this done. We've also been talking to our primary care docs and our pediatricians about how they're going to help, and our schools about how they're going to help us with the folks under the age of 16, the 12 to 15 community. And And I think in many ways, the biggest thing we as governors have tried to do is pursue a variety of data-driven approaches based on what we're hearing from people on the ground and recognizing and understanding that the same approach isn't going to work in every place, and you got to be willing to be flexible and put a lot of different approaches into the mix to get this done. And let me just close again by saying how much we appreciate the chance we've had to work with your administration on this, and we're going to work really hard to make sure we get everybody who wants a vaccine vaccinated by the 4th of July.
Well, thanks, Charlie. Thank you. You're doing a hell of a job.